So hi everyone, today in this video we're gonna develop another way to solve problems by kind of incrementing and making connections between the mental models in a way that so them by getting integrated they can so help you to solve problems. So what we're trying to argue is we have been done in this channel. We have been talking more them lonely and see so what they are about, where they so tend to be perceived, these type of patterns that we declare as mental models, but also we as well argue that where they become more valuable is when also they're applied in our decision making to solve problems, to create so solutions for them. And then so obviously with this type of sense, I'm gonna to try to solve in a simplest way. Obviously, I'm not a specialist, but I'm gonna see and show to you, as you probably not being a specialist as well, or you can look better and even try to create some simple solutions to solve some of the problems that we normally face. In the last video we talked about the problem that is the lack of purchase power that people can have today in a lot of countries in comparison with the price of the goods that type of countries have. And then so today we're going to talk about probably the success of healthcare treatments. So what you have to understand is that what's the system that we're presenting. So we as a society, obviously, we have as one of the most fundamental needs is the healthcare. We want healthcare type of treatment. And the reality is that so we have everyone as and wants that type of treatment. So everyone has that type of need. But obviously, so what do we have as other type of the good that can offer in economy? Everyone tends to as well have so a need to get food, but neither everyone producing doing food. That's why so mental model of specialization is a pattern that we see recurrently. You can consume a lot of things in your day-to-day life, but probably just like in that, just 1% you're the one that produces that because just got need to specialize in doing a specific job because that's where comes the effect of scale. By existing so much people in society, they can create a lot of groups that then so focus in doing certain specific things and in producing quantity that's enough to satisfy all type of population, while other elements in that system, other groups, they tend to produce as well other type of product that satisfies other type of need that as well can guarantee to satisfy the all type of needs that every population has. And then so you can just by being good in doing something, you as well can consume it a lot of other things because you receive it just by what you do as the best as possible and what you really do in your day-to-day life. You just have one job, and then so you're able to get money enough to buy all other things. And then so obviously it's the system, it's like the most fundamental type of characteristic that this economy tends to have. But as well, obviously, we have to create incentives to these type of dynamics to exist. So we have to facilitate the education, facilitate them getting access to work. And obviously, so making him to work, I have to create good conditions, guaranteeing that they don't receive so bad treatment while they're working. That so guarantees to them producing constant outputs because I facilitate the stage of doing it. And then so obviously amplifies by all groups, economic groups that we have in our system. So that's the foundation of elements in economic system everyone wants needs. The easiest way to do it seems so to get groups that are specialized in doing something. Everyone specialized in what they are better and what they study for, and it's the only thing that the people needs is doing their only job where they do like or where they do job or where they so are present, and so they can get all other needs as well satisfied because they receive money to as well buy whatever is the thing that they want. They always so convert to having specific type of value in accuracy that ours adopt. That's the system that we understand. Applying so for the healthcare system. We have people that have needs, we have people that have work. What's the problem of the healthcare? Or we have like that much of demand in comparison with the supply. So we have a lot of people that have a lot of healthcare type of demands to get so solved by the people that works in healthcare, nurses, so whatever is the type of work that you have in healthcare. Or you can have a problem as well. It can be something that can present that we have too much of healthcare people in comparison with the people that works, that people that demands that work, which so makes the people that works on that we're saving so much because they don't justify the presence in quantity in comparison what exists as a demand. So what normally is the problem is the first one. So when we have probably we don't have enough people to serve for the people that pretend to get it. It's probably so where we see it more. And then what we have here, how you can solve the problem as a majority of the type of countries tend to solve is a lot of people pretending and wanting to get healthcare for not existing probably the enough type of resources to satisfy. What do you have to understand? We see that it has to exist a lot of incentives to economy to work. So we have to make people to like in certain specific way. They have to get incentivized to do it. So probably you have to work in incentives for nurses, for doctors to so sustain in doing that activity, not be great for others that can get specialized. So working in education, making it easier to have access to do it, obviously not having a trade-off, not simply a trade-off, by making it easier as well, so make the people not getting enough education to perform at good stage. But if you want to become efficient, that's obviously so the ultimate goal for producing something, wherever it is professionals, goods, materials. Efficient is spending as much less as possible of energy, money to get so dim produce the max of output in comparison with the minimizing the whole what you spend. So being efficient in having the formation of people. But then probably you have to look for other sides as well, the demand. All to make it doesn't have too much type of demand. So what do you have? What's the demand created? So by people perceiving that they need to get healthcare type of treatments. And then so this comes with you taking the fundamental principles. How to not make people get so with a certain type of disease. Or you probably can work on trying to prevent. And how you trying to prevent? Probably making easier people to have access. Have access to what? Probably what are the things that science has to prove that contributes to people to have health. And then so obviously you look for thinking scientifically. You're looking for health. Health is one of the best ways to get because you can prove things are good or not for your health scientifically talking. What are like the most important things that so you have to promote, you have to guarantee to people have in scale to so already work a lot in become less saturated at the demand the existence of people that have diseases. So what we have been proven: exercise, nutrition, control stress. So these three main things, and you can include as well the rest, like having good rest, good nights. So this is the type of way that you have to understand, you have to monopolize, you have to work on that. So nutrition, making so the things become less expensive for people, creating incentives to people to consume things that are good, making it harder to people to consume things that are bad. With exercise, exercise requires you to do what? Requires you to have time to do it. Probably so you have to work in creating incentives to make people to do it and guarantee that they do it. So promote it in terms of and creating so even another alignment of incentives. So you know that's something that's good for people. You probably can create incentives for other type of people, like the groups of work that they're doing it, to kind of have the incentive to make like and having spaces of exercising the work. And with that you can, so if the companies have, you can create like not a tax free, but you create incentives to them to creating an environment that's prone for people to do it. See how you have to work systematic, see how you have to understand the stakeholders, and if you want so certain actions to be done in a higher rate, you have to create an alignment of incentives so to make a specific stakeholder that try to manhandle, that is so the people that get disease or not, that everyone can get it, so making them have incentives to do the task that you want, making it easier, facilitate, creating them inspires that while they're doing the action that you want them to take, so increasing the value that they perceive it, and not just relying in long-term effects and expect that people just so perceive that exercise is good. Not, you will focus in increasing the experience while they're doing it. So promoting foundation associations, groups like sports, while in through the community, that because you have a link of being good for health, but as well them socializing, that so make it easier people to do the task because they're socializing, they're in contact with people that they do like. See normally how you tend to create better environments while you more create justification incentives to do, other than just because it's healthier or not. You're all focusing in them having so good type of experience by focusing the groups that are stuck in. So it's important to look for it. So creating incentives may handle the system to them to increase the rate that they so contribute for the things that you scientifically has been proven that contributes for health, which so already cuts a lot the demand that and so the rate of people get disease, which so already helps you to not exist too much demand in comparison with supply. With the supply to exist more, creating incentives to them to sustain here. Normally so as because the neither always something that's profitable. What do we have? This type of healthcare we create like they're sustained by we so getting the taxes and investing so in creating a healthcare type of system. We happens a lot of in Europe. And then so obviously if you want to get enough resources to pay so in enough quantity of wages to so stimulate people to work on that area, probably we have to look so for corruption. So if it is existing the allocation of that type of resources for other type of elements, groups that so obviously they have incentives because everyone gets and wants to get as much money as possible, probably creating a way that guarantees that people don't corrupt the action of that don't so create and do the action of corruption. So see that basically all the problems is understanding the system, think critical about what so are the hypotheses that specific problem exists, how to handle it by understanding so the fundamental principles of the system that you are, and then so what's going to be the potential consequence of you taking action. See, so you understanding the problem, understanding the system that you are, it already solves a lot of the problems and helps you to understand better the consequence of the potential type of action solutions that you create. So I expect this video as make you gain insights as well. Obviously the simplest way to solve this type of problem that we talk about in this video, but I hope it was enough to make you understand that even me as a non-specialist, you as well, if you're not, probably you're not, you can as well think for that in a critical way and so choose people that they can have power to solve it. So I'm talking more about what's the foundation, the ability and the skill that's already so present in their actions and not just so falling in pupilism. So I expect these videos make you a better person, and I hope to see you in the next one in this channel. Don't forget to subscribe.